Good afternoon. I'm Dr. Siddharth. I'm a medical gastroenterologist, hepatologist, and interventional endoscopist based in Nagpur. I'm the director and founder of Star Gastrocare Gastroenterology Center at Nagpur. Today, here I am to introduce you about the Andtil protocol and educate you and create awareness about fatty liver disease, metabolic syndrome, diabetes, pre-diabetes. So as we all know that India is the global capital of diabetes, and fatty liver disease is prevalent in up to 30 to 40% of the Indian population. Obesity, being a global pandemic, has now shifted to the Indian urban, predominantly in the urban population, and affects around 30 to 40% of the total population. Now, if you look at all these symptoms, the fatty liver is the precursor of diabetes, of hypertension, cardiovascular diseases, obesity, and having fatty liver is usually asymptomatic. And it is conceptually proven that having weight reduction up to the tune of 5% can reduce and reverse fatty liver disease. If there is progression of fatty liver disease, that is known as tier 2 hepatitis, that is, the enzymes are going to be elevated and is going to cause inflammation in the liver cells. Reduction in the body weight up to the tune of 7 to 10% is going to cause reversal of fatty liver disease and NASH, that is non-alcoholic steatohepatitis. Obesity, along with pre-diabetes, fatty liver, they all come hand in hand. At this point, as a medical practitioner, we have medically proven therapies for reversal of fatty liver disease and pre-diabetes. But in combination with that, there should be a holistic approach to treating pre-diabetes before the florid symptoms are manifested by the body, in intervening at the right time at an early stage, so that before the body has manifested with diabetes, fatty liver disease, NASH, there can be reversal and prevention of hypertension, cardiovascular diseases, ischemic heart diseases. So, one word about gut microbiota also in this, that with the advent of fatty liver disease in the body, there is going to be dysregulation and dysbiosis of the gut microbiota. In simple words, these are a lot of bad bacteria which are going to increase inflammation, increase pro-inflammatory state, cause bacterial translocation, and overall systemic inflammatory response is created in the body, which is going to cause damage to the liver cells, damage and progression of the disease. So there is a role of gut microbiota which has been proven that if you have good gut microbiota, that is going to cause reversal and maybe lack of progression of fatty liver disease. Pre-diabetes, in the initial stage, usually medicines are not started at this stage. And at this time, dietary and lifestyle modification, predominantly, most importantly, weight loss is advised. So at Andtil, there is a protocol which has been created in which the body type is assessed, and not only just pure medical therapy, initial assessment of the body fat composition, fatty liver stage, and ultrasound pre-diabetic medical checkup is done to assess at what stage is the disease at. And then there is intervention in the form of not only medical therapy, but alternative therapies also, along with other therapy, creating a holistic approach which is going to cause reduction in the body fat levels and reduction and reversal of pre-diabetes and fatty liver disease, in which there can be multiple forms of therapy, such as cryotherapy, lipolysis. That is, the body fat is broken down and resulting in a transient weight loss. And since the body fat is the driver of the pro-inflammatory markers and creating an inflammatory cascade, so body fat is broken down, along with, most importantly, dietary therapy. That is, restriction of your diet, modification of the diet, along with that alteration and timely, according to the diurnal variation, diet is modified and then given. In simple words, dietary modification has to be considered as a doctor's prescription, where the diet which has been advised you every patient has to consume it as a form of medical prescription. To summarize, we want to wish Andtil, which is a protocol which has been conceptually approved, a lot of studies backing up the data, and having a holistic approach for reversal of pre-diabetes, fatty liver disease, and overall global burden of cardiovascular disease, which will be manifested later on. Initially, just having fatty liver is not going to cause any symptoms to the patient. So, for many years, usually people are ignorant about this, having obesity, fatty liver, pre-diabetes. But by the time the symptoms manifest, it may be a little late. So, intervening at the right time and not going directly jumping onto medical therapy, but having a dietary and alternative therapy approach can cause reversal, or for that matter, delay in progression of all the cardiovascular, metabolic, and liver disease cirrhosis, which can manifest at a later stage in life. So, I would like to wish Dr. Manjunath Patil and Andtil team all the best for their holistic approach in intervening and modifying a disease progress at an early stage. So with this, I would like to convey my best wishes to Dr. Manjunath Patil and team Andtil, and wish them a lot of success. Thank you.